agreement is neither correct nor is it acceptable.
Well, Nathalie Moll is the Director General of the European Federation of Pharmaceutical Industries and Associations and joins us from Brussels. What do you make of what's going on?
Well, good afternoon and thank you for the invitation. Indeed, we are nearly 12 months into this pandemic, and as the Commissioner very well says, this is about people and it's not about statistics or numbers. So the objective that we all share, and the pharmaceutical industry in particular, is to be able to vaccinate as many people as quickly as possible. You will remember that about 12 companies pledged to develop and manufacture a vaccine if they were successful by the end of 2021. And today in Europe, we have 2 approved and hopefully 1 soon as well, the AstraZeneca, but it's very short of the 12. So all the attention is being focused on the 3 who are now already have successful vaccines. And indeed, there is a discussion going on. Just in the 1 month since the approval of the first vaccine, the Pfizer-BioNTech, the EU have been supplied with 7 million doses of vaccine. That's quite incredible. If you think just 12 months on, we're already with a new vaccine supplied to 7 million people. And as more vaccines get approved, the capacity will also increase and the delivery as well. But manufacturing, as Pascal Soriot explained in his interview, manufacturing a vaccine is not manufacturing a chemical. It's actually consists of microorganisms and very complex biotechnological steps that at times can create fluctuation in the doses and the amounts that are produced. And that is what has happened in some companies. And we're working day and night to fix those issues. They are not necessarily foreseeable, this being biology. And I think the efforts that are being made are outstanding. The collaboration between the scientific, manufacturing, logistical capacities of institutions, governments, health systems, regulators, industry is just unprecedented and really something to recognize. Oh,
well, we are all in awe of the fact that it's achieved in, 10 months, what would normally take 10 years. And this has been lauded and the pharmaceutical industries have been applauded for this. And now here we are very quickly in the middle of a rather big row with the European Commission saying, no, that pharmaceutical company's not been honest with us, and now calling for it to uphold its legal and moral obligations. I mean, how's it come to this so quickly?
I think in COVID, everything is unprecedented. And as you mentioned, the speed is incredible. And so the speed of development, the way these our companies have had to work also with partners, transfer the technology, make sure that the laboratories increasing the capacity of manufacturing are doing so in the right way is also completely unprecedented. You would have taken a much longer time. And I would say that also the level of tension is high for all of us. Look at us, where I'm here sitting at home, and most of us are, we're in a very new world at the moment. And I think we are forgetting perhaps that we're dealing with biological systems. And if you imagine that these vaccines that are produced in 1,000-liter, 2,000-liter vats, and with all the fluctuations that you can imagine when you're producing a vaccine from a biological system, we have to be a little bit more aware. If you think back just a few months ago when we were trying to foresee when the first vaccine would be approved, I don't know if you remember that, and nobody was willing to give a date precisely because we're talking about an incredible advance in science done in a very short amount of time, but that has to meet all the safety requirements and is not easy to scale up to that extent. So a flu vaccine, yes, sorry, go ahead.
No, well, whilst I get that, the European Commission, their argument appears to be, that, but bearing in mind what you've said, that the vaccine seems to be available more in the UK than it is, say, at the factory in Belgium, then they should have call on what is being produced in the UK. Many people are pointing out the fact that the Europeans ordered from AstraZeneca later and they paid less for it. And we are talking about commercial decisions. And of course, the Europeans have yet to give the OK to the AstraZeneca vaccine.
Indeed, we're planning. The UK also started vaccinating before Christmas, or just after Christmas, I think. We were all very envious of our colleagues in the UK already being able to be vaccinated. So the timings are different. And it's not really our place to comment on how different countries have run their vaccination campaigns. That's not the issue. The issue for us is to make sure that we can supply globally, really, and that we make sure that the trade and in all the various components is possible, and that we can supply the effective and safe vaccine to as many people as quickly as possible. And I think that that's something that we've never done before. We're learning. Solidarity has been, I think, the leitmotif of this entire pandemic. Although at the beginning, countries panicked and closed borders, and it was very much a lack of solidarity. I think we've really learned from those days what a lack of solidarity can do, what restrictions can do in terms of posing serious obstacles to the movement of goods, to the movement of protective personal equipment, to medicines, and we cannot afford that again. Supply chains for vaccines are global, and we need to make sure that we protect those supply chains so that we can be as efficient as possible in getting the vaccines to as many people as quickly as possible. Nathalie,
I'm really grateful for your time this afternoon. It's good to talk to you, Nathalie Moll. Thank you very much.
Thank you. Bye.
Now let's have a look at the weather, the forecast with Thomas Schaffenacker.